Okay, so we're going to get started on the SOAP notes in general that you need to write for class. So let me start the slideshow here. Play from start. Okay. Oops, no, I didn't want to play from start. Okay, so let's go here. All right, so subjective. Remember what they know, what they see, what they feel, what they know, any of the stuff that they tell you. So 80% of the time you will figure out what your assessment or diagnosis is based on the history of present illness. So that's why it's really important to take a good history, because that will give you a lot of answers. Many times the physical exam is going to be normal, or maybe you'll have one abnormality, but most of the time you will end up getting your diagnosis from the history itself. This is what includes all of the subjective parts, what the patient knows. Make sure you put bullet points for your past medical history, allergies, meds, social history, family history, and health maintenance. Your review of systems should be organized also, but not necessarily in bullet points, but by systems. So chief complaint. So what is the chief complaint compared to the history of present illness? The chief complaint's very brief. It's basically what the patient's being seen for. So if they come in and say, I have a sore throat, you're going to say patient is here for a sore throat. I put some examples here. I have low back pain, quotes. So you can do quotes of what they're telling you, or you can just say low back pain for 3 days. Let's just say they're here for a complete physical exam or sports physical. You're going to say here for a complete physical exam, or you're going to say here for sports physical, for basketball. Done. That's all you have to do. You don't write anything else. Don't go into details, because that's what you're going to write in the history of present illness. So the history of present illness, I ended up dividing it into, trying to get this thing down. There we go. Into acute and chronic, because it's going to be different how you chart acute things versus chronic. Because if someone has diabetes, you're not necessarily going to do your old charts, because onset could be years ago, location, multiple places, duration. I mean, it's just more difficult. So that's more of a chronic follow-up, which I'll go over in the next thing. So all of your focused acute visits, which you will be doing a lot of those, will be your old charts. So, and actually I put onset. Why did I do that? Okay, I kind of put location twice. That's kind of strange. Okay, anyways, let's do onset 3 days ago, left leg pain. Oh, I think I meant to do, I have no idea. Okay, but just know the rest is good. It's all good. Onset 3 days ago when I woke up and started walking. Location, left leg, front of my knee. So you could put both. Duration, 3 days. It's been constant for 3 days. Characterizing factors. Well, it hurts when I get up from sitting. It feels sharp, then changes to a throbbing pain when I'm walking. Aggravating factors, changing positions, continued walking. Relieving factors, resting it, sitting or laying down. Treatment, I've tried heat, but it does not seem to help. Severity, it's hindering my ability to exercise. Other things you can put under treatment, you can say patient denies using any other medications, oral medication. She has just tried heat and nothing else, just to make it know that you have addressed asking if the patient has taken anything else. Okay. All right, so this is your chronic stuff. This is where you get more into follow-ups. And in APN 1, I really want to have you focus on just acute things. Sometimes, depending on your place that you're at, you get all chronic follow-up visits. So I want to make sure you know this. And when you're working as a nurse practitioner, you're going to have a lot of chronic follow-up visits. So what you want to do is identify each chronic disease. All right, the unstable ones come first. So if someone comes in with diabetes type 2, hypertension, let's just say those two, and their blood, let's say their A1C is too high. So I'm going to put diabetes. Patient has diabetes type 2, was diagnosed, blah, 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 which I'll show you the example at the bottom for the high cholesterol. And then you're going to talk about the hypertension. So that's the important thing. This is your history of present illness, remember. Then lastly, you're going to identify any acute issues going on. That's when you use your old cards. So if they say, yeah, but my ankle's been hurting me or my heel hurts, then you're going to mention that last. One thing I want you to remember is that you're going to have, everybody's going to be with a different preceptor. They may do things a little different. Remember, medicine's a gray area, so what I say, I write in erasable pen, just because I'm telling you how I'm telling you how you're supposed to be taught to do it, basically. And I showed you the coding and things like that. But again, everybody's different, okay? So just remember that. And this is something that we're going to have live face-to-face Blackboard Collaborate meetings, and we can talk about those things too. That's one thing that's interesting, is you get to hear all the different stories and why physician preceptor does this, and so okay. Anything with chronic diseases, you want to identify the problem, then the medications they're on, then do they have any issues or stability of the problem? Do they have any medication side effects? So this is an example I put about the hyperlipidemia. It was diagnosed 2 years ago, taking the atorvastatin at 40 milligrams per the ACA/AHA risk calculator recommendation. He's taking his medications daily, because is he being compliant? Is he following the other treatment methods for hyperlipidemia? What does he do for exercise? And does he have any side effects? Does he have any side effects to the medications? Or think of complications of hyperlipidemia. He's at higher risk for coronary artery disease, so he denies chest pain, shortness of breath, muscle aches, which you can get from the statin, hair loss from the statin, memory issues from statins. So that's a thorough follow-up on hyperlipidemia. That's chronic visits. I'm going to skip over this. Then you're going to do your past medical history, surgical. I'm not going to go over all these. You guys can read these. You guys can read these also. I just want to get to now review systems. You want to make sure you don't miss any important symptoms. You want to include any pertinent negatives or positives that would support your final diagnosis. All right, so for acute episode visits, example, sprained ankle, sore throat, you can omit like gynecological, rectal, GI, abdomen. There'd be no reason to, right? But remember to include the cardiac history. Now the last word's taken, you can't see. It says a statement of refer to history present illness is not sufficient. So let's just say if you're going through each system, you can't say CHPI, because there will be a lot of experiences, I think, where you'll see where the review systems will say CHPI. That's not sufficient. You need to say patient complains of sore throat as per HP, as the history of present illness states. You don't have to go into detail on that, but you can say see the history of present illness as patients for more details regarding patient's sore throat, etc. The details of that, okay? Also, I don't want you to write referred. Some people write referred next to each system, like meaning it's in the HPI, or some people write deferred, like you didn't do it. So you wouldn't do that. You just won't put those in. So that tells me you just didn't do that system. You don't have to write down every system and say not applicable or anything like that. You just put down the review systems you're doing. These here are the review systems. Whoops. I ended up, it says hematologic, and below that's allergic, immunologic, which you should have on your slides anyways. I posted in Blackboard, in the area where this all is, I posted a template for review systems that gives you the details under each system. So you have the systems, and remember you have the elements under the systems. And I also did one for physical exam for you, which hopefully will help you with your SOAP notes. Okay, now you figured out what they know. Now you're going to figure out what you know. You're going to do your physical exam, any diagnostics. You're going to do your assessment and plan after that, okay? Physical exam, everything you know. This is one thing, actually, think outside the box. Don't get too focused on their complaint. Should be a T at the end. This is what I'm saying. A lot of people will come in and say, they are, let's say they'll say, I have wheezing going on. Don't get too focused on thinking, okay, this patient has asthma. Sometimes we can do that. We can get focused on what they're telling you. Say they come in with something from Google and says about asthma and all this stuff and get you really into drinking the Kool-Aid on asthma and thinking they have asthma. But try to not do that. Don't think that just because they come in with those, meaning it's that. It could be, but maybe it's GERD. Maybe it is they have pneumonia. Maybe they have something else going on. So make sure that you don't get too focused on their complaint. That's the whole art. There's an art and a science, and intuition goes into all us making our decisions too. Document specific abnormal negative findings you're going to do. You don't want to write just abnormal without elaboration. So you need to say what is abnormal when you're doing that, okay? And then I'm not going to go through all these because I provided some samples for you in the thing. All right, your assessment, which means diagnosis. What you're going to do for your SOAP notes is do diagnosis. You're also going to put in a couple differential diagnoses. Differential diagnoses are, let's go back a little bit. The patient comes in with a sore throat and a cough. Your differential diagnosis is a list of things it could be. So there are many differential diagnoses books out there. I think you guys have to have one. I like the little fairies pocketbook one because if they have like right upper quadrant pain, left lower quadrant pain, you just look up left lower quadrant pain. They come in with that. It's kind of like you're a detective. And I tell the patients that, you know, abdominal pain is like detective work. You have a lot of organs in there. If you have left lower quadrant pain, what could it be? Diverticulitis, ovarian, if they're a female, gas, acute gastrointestinal illness, bowel obstruction, etc. So it's your job to be able to exclude these narrow it down to one, all right? You have to exclude the most serious. So diverticulitis would be the most serious bowel obstruction, diverticulitis that can perforate and that can be dangerous. All right, so when you think of differentials, that's your list of other diagnoses that it could be. So let's go back to this assessment. Patients coming in with, let me switch it over to the left lower quadrant pain. At this time, I assess them. I think that they have diverticulitis just because of the symptoms they're having, how it's been going, and plus I've seen it a lot. But I'm not totally positive. So my medical diagnosis is going to be left lower quadrant pain, all right? So then when you're going down in your SOAP note, you're going to write this differential diagnosis that you think it could be. Now what are you going to do? What's going to be your plan after that? That will be your plan. So you're going to write your diagnosis. That's going to be related to the chief complaint. Okay, they come in, they have abdominal pain. Now you've narrowed it down to left lower quadrant pain. You can write suspect diverticulitis, acute diverticulitis. You're going to number each diagnosis chronologically. Then you're going to list the plan after, directly beneath it. If any chronic illnesses were addressed, they need to be listed as a diagnosis and plan related to each diagnosis. So diabetes type 2. Number 1, diabetes type 2, plan, da-da-da-da-da. Hypertension, plan, da-da-da. All right? The most important diagnosis first. If they don't have left lower quadrant pain, you could just write down the chronics. If the only thing that came in was left lower quadrant pain, and let's say they have obesity and they're a smoker, you put your left lower quadrant pain first because that's the most important. Then you're going to put morbid obesity, and then you're going to put tobacco abuse. Don't forget those too. A lot of people forget the obesity issue and tobacco. This is an example that I put here for you. Example, chief complaint, my back hurts, but the patient's a tobacco user and obese. So, assessment diagnosis, acute lower back pain, that's the first one. Then what's your plan going to be? Obesity, BMI's 30, your plan, tobacco abuse plan. This is when we get into the differential diagnosis. You're going to list 2 to 3. You're going to list 2 to 3 differential diagnoses for your primary diagnosis. So back here, you're going to list 2 to 3 differential diagnoses for acute lower back strain. What else could that be? Could there be a lesion in there? Could there be a tumor? You know, that kind of stuff. So that will be your differential diagnosis. You need to explain that. In follow-up or chronic conditions, add potential complications related to the disease instead of a differential diagnosis. So if that's all you have are chronic issues, then if it's like diabetes, that's easy, because think of all the complications related to diabetes. What eyesight, you know, retinopathy, nephropathy, gastroparesis, peripheral neuropathy, coronary artery disease, stroke, MI, you know, so there's so many. So that's what you would do for the chronic conditions. So for example, another example I put here, diagnosis number 1, acute lateral knee pain plan, differential diagnosis, lateral, collateral, ligament sprain, and explain it. Lateral meniscus tear, explain. Iliotibial band tendonitis, and explain. Okay, so I hope you understand the diagnosis and everything we've gone over so far. Okay, now we're at the plan. The plan will be interventions or things you do related to that diagnosis. So that could be labs, diagnostics, medicines, etc. This is an example that was taken from a SOAP note from a student. Just an example of how you really need to be thorough. So instead, not just medication prescribing, but yet details on teaching. Think about being very thorough, because remember, let's just say I'm seeing this patient after you saw the patient. I want to look at this plan and say, okay, side effects were explained to the mom. They were told to call the office. They didn't do any labs at this time, and I want to know exactly what was done. So that finishes your SOAP note portion. So for example, when you're seeing patients as a nurse practitioner, that's going to be your SOAP note. But your student, so there's some extra things that need to be in your note. So this is going to be the rest of your note. So just remember, if you don't put this stuff, the important stuff within your SOAP note that we talked about, I've had students put things in this part of the note, but not in their SOAP note. Like for example, I had a student put that the plan for the sore throat, what did they write? Okay, for the plan for the sore throat, they put diagnosis, sore throat, plan, talk to mom about amoxicillin. That's all it said on there. But then when I'm reading the rest of the note, at the bottom, they say, well, we ended up ordering amoxicillin, weight was this, you know, we talked about side effects, but she didn't put that in her note. And I'm like, but that needs to be in your note, because that's what your SOAP note is. The rest of this note is for, you know, your own learning experience and to kind of put things together in your head. It's a learning experience. So the rest of the note is pathophysiology, which you can read this on your own. If you have any questions, let me know. The only thing we don't want you doing is copying and pasting. That's been done notoriously in the past, and we're really trying to crack down on no copying and pasting. The adjuncts are, they're the ones that brought it to our attention, and you need to be able to, at this point in graduate school, be able to read something and summarize it. Evidence-based practice, which we're going to be going over the first 3 weeks of APN 1. Which you'll get to know the United States Preventative Task Force. Pharmacology, you'll need to write down that. Write about one drug that was prescribed during the visit. If no new medications are prescribed, then you would select a medication that could be appropriate for the diagnosis chosen. All right, so let's just say someone comes in with a viral infection and they don't want to take a medication. You can choose Tylenol. And we talked about not copying and pasting. And then the last thing, which I think is really important, is final clarifying comments. So you can read this, but one thing I want to say is there's many times where you'll see the provider maybe not making the decision that you thought that they should make, or not following guidelines, or you wish you would have had more time with the patient, but let's just say the providers like came in and you ran out of time. This is the time to reflect back, because let's just say, for example, the note that you're writing and your adjunct is grading, there's not a plan on there or the treatment method maybe was wrong. Say they prescribed Cipro for a UTI when first line is Macrobid. So you need to write this on there so your adjunct knows that you know that Macrobid is first line for a first-time UTI, and the provider should not have done Cipro, because then the adjunct's going to say, oh, okay, the student knows exactly what's going on. She looked up the guidelines. She knows what the guidelines are, and if she were to do it, she would have made the approach differently. So anything you would have maybe added that you were in the office visit and you wanted to add or do anything different. Okay, so you're going to read that. The other thing, APA format. Make sure you do APA format. I put down an example title page. Remember your running head, your page number, and this is exactly how we want it to look, okay? So no excuses now because I have it all written here. Now, yeah, you have to write the case number, they put the ICD-10, and you don't have to necessarily put the treatment underneath, but definitely just write acute cystitis and hematuria, or acute low back pain. Please refer to sample review systems and physical exam component in Blackboard, your clinical handbook, always. This PowerPoint focuses on a SOAP note, but I did give you some coding basics. Go to your APA module if you're not sure. All right, so if you have any questions, please feel free to ask me or Dr. Parvey, and I hope that this will help you as you're beginning your SOAP note writing adventure.